Hello, everybody. You are joining us for our Center of Excellence for Infant and Early Childhood Mental Health Consultation webinar on engaging families at all levels of the mental health consultation system development. Thank you so much for being here, everyone. We have our SAMHSA information disclaimer slide here. The Substance Abuse and Mental Health Services Administration is the agency within the U.S. Department of Health and Human Services that leads public health efforts to advance the behavioral health of the nation. The views, opinions, and content expressed in this presentation do not necessarily reflect the views, opinions, and policies of the Center for Mental Health Services, SAMHSA, or HHS. So we have Kim Eason, who is the Special Initiatives Coordinator with the Wisconsin Child Welfare Professional Development System. Welcome, Kim. And we also have Linda Delamata, who is our Training and Technical Assistance Director with the Center of Excellence. And then myself, Dawn Yazzie, an expert mentor here with the Center of Excellence. And our next slide, we have our webinar objectives. We would love to share with you the importance of including parents and families in infant and early childhood mental health consultation. I know that's a mouthful, so what we'll refer to it in the webinar is consultation or mental health consultation. We'll help to identify how to engage families in 3 levels of consultation. The first one as a partner in consultation for services to their child, and the second one as a stakeholder that informs the consultation process. And the next level is as a leader in consultation systems. We'll be covering these 3 areas today, and we'd also like to share with you how it's important to understand the role of culture when engaging families. I will hand it off here to Linda.
Thank you, Dawn. Welcome, everyone. Here's our agenda for our webinar today. We're going to start with talking about engaging families in the consultation process, and then how you get feedback from parents, both formal and informal. We're going to identify, engage parents that are going to serve as representatives for other parent voices, and then how we formalize parents in a leadership role in your consultation system, and understanding culture, the role of culture when you're engaging families. And then we'll go through some resources that are in the toolbox, that Center of Excellence toolbox, and then we will come to closing. So let's start with understanding the importance of including parents and families in consultation. So it used to be, as we looked at how we involve parents, that some of the things that we might do were like, let's talk to this parent and let's tell them what's happening with their child and let's see what they think about that. That was what we called family involvement. We are letting them know what we're doing and we're sharing with them things that happen. But what we're hoping to talk about now is it's not just involvement, it's engagement, which means that we start from the beginning. The families and the parents that we work with are partnering with us from the very beginning so that they're not just receiving the information, but they're collaborating with us to help develop what we're doing. Their voice is important to the work. No one knows their child better than they do. And when you involve parents from the beginning and you're asking them to be a part of designing things, be a part of what happens in the supports that they receive, there becomes a better, closer relationship between those who support the children and the families. And because this is relationship-based work, that's how things move forward. We are promoting that this isn't something that happens just from one to another, but between each other and working together to make sure that things are smooth. And we can sometimes make assumptions if we don't have that all partners involved. I'm going to give you an example of a program I worked with where this child started displaying unusual behaviors that wasn't like him. And he was typically very quiet and would cooperate with transitions and movements, but he started taking his toy truck and kind of running it into other people's toys. And that kept going on for a couple of days, and they called me in for a consult, and they were guessing at what might actually be happening with that child. So we started asking questions like, I wonder what might be happening in his world. I wonder if he doesn't feel well. I wonder how he's been sleeping. Lots of questions. Then the providers say, gosh, I don't know. They started engaging the family and saying, we're seeing some things going on with this child, and can you help us understand? And they started talking, and they started having conversations, and the bottom line was there were some things impacting that child. His dad had taken on additional work and wasn't home as much, and so that was making it difficult for that child. And without the language to say this is what's going on, he was using behaviors. Instead of assuming things, working together, building together, being a part of is how we are promoting this work. So we want to talk now about how do we engage families in the 3 levels of consultation. Those 3 levels would be as a partner in the consultation services to the child, as a stakeholder that helps us figure out how our work happens, so they would be informing our practice. And then how can we get parents or families to be a part of the leadership of our early childhood consultation? So we'll start with involving families as partners in the consultation process. One of the things we want to promote is that all partners who work with the children are a part of the process. And so that would include families, people who are providing services like home visitors or teachers or teaching assistants. Everyone is together at the table figuring out how we support that life of that child. And then we want to understand more about what's happening to the child in all realms of its life. So that involves listening, not telling, not saying here's what's happening, but listening and together having conversations. And it might take a lot more time to do that, to start with listening, but it actually saves time in the long run. Because if we're working on an idea and we are trying to make sure it happens, it may not be the right idea unless we've had everybody involved. That is why it's critical to have everyone there. I was working with a program where we were trying to figure out how to best support a child, and eventually the consultant and the teacher said, we can't engage that parent. We don't have really time to do that. We're going to write a plan and put it in place, and then we'll come back and evaluate it and see how it works. And I'm saying, why can't you involve the parents? And it's like, we don't have time. And not having time, then they put something in place for a month that really wasn't that child's need. And then when they went back and took the time to engage the family and understand more about what was happening, the plan actually met the needs of the child. So it may seem like it's time-consuming, but it is not in the long run. And because the families are the experts for their child, it's important to have the information as we create an effective plan. We believe that families are critical to the success of their child. I know also that infant mental health, one of the basic tenets is that we do a strengths-based approach. We are focusing on what works and how to promote what works, and so we need to do the same thing as we work with families. And in the work that I've done, I've heard people make statements like, boy, if that family only had more time to spend with that child, he would have learned how to listen and sit down and be still. Or I've heard educators say, things are changing with children now because parents are not spending as much time with them, etc. That kind of conversation is not a strength-based approach. So what we're hoping to move to, and what many people have moved to, is what skills do the parents bring here? What information do they bring to us? How can we together collaborate and make this work? And so not being accusatory, but instead being supportive and collaborating together. So maybe we start early. I've seen some programs that start before the child even enters their program, supporting, gathering, building that relationship. Home visiting is all about building the relationships with the family so we can listen and we can help them as they address issues. The other thing that we want to talk about is having families as a stakeholder to inform the process. We're looking at families who may have received consultation services, and maybe through home visiting, maybe through a consultant to their Head Start program or to their child care program, but they've already received the services, so they know what it feels like. And it can be so confusing when someone says infant early childhood mental health consultation. It conjures up all kinds of pictures for people. Sometimes that word, mental health, is a bit scary. So having a family who's already been through the process and is willing to share their experiences can help the delivery of services be smoother and help other parents understand what might be coming and what to expect. It also helps to remove that stigma, and the word mental health is sometimes scary, so having someone who can help a partner to remove that stigma and to share their experience helps a new person, a new family be more involved. The other thing that we are promoting is that you want a family to be a part of your consultation system. No one knows more than someone who's been through the service, what works, what doesn't work, how it felt, what made them understand more. We hope that we can identify families that can be a part of informing the leadership. We invite families to come. We look at what role they could be on a leadership of developing and designing your consultation services. And it isn't like, oh, let's have a family attend and they can just be a representative. You want them to take part in the work as one of the leaders in the team. Help to define what it is that they would be doing. And so to do that, you have to prepare the parents or the families. You have to help understand how do you engage in this system, what is it we're asking you for, and clearly provide them with some training and some support so that they'll understand what you're asking them to do. It takes time once again, but in the long run, you're better informed as you do the work. Here are some ideas about engaging families in this process. You want to reach out to families that already receive services. Be clear about what you want them to do. Be clear about their role. And it helps to have them partner with someone who's already been involved. I've heard people say, invite more than one parent so they're not the only parent on that team and they can support each other as they do the work. I worked with teams where they partnered that family member with someone from their team and they had conversations, they processed the meetings afterwards, they made plans for the next meeting, and it was helpful in getting the feedback from the parents and the ideas from the parents to help the team move forward. Also, it's helpful to be clear about the logistics of your team and the work. So if someone can't get to your meeting, can you do it by a virtual like Skype or Zoom, or is there a way to have someone else provide them with transportation? Just sometimes we have to look at what do we need to do so that parent is there and involved and helpful and we support them. Sometimes there are barriers to getting parents to your meetings or even to getting them being able to join in other ways. So what are those barriers? Here are the ones that we've run into that we're going to share. Transportation is a big one. Many of us come to these meetings as being a member of an organization or part of our role. So we are doing our work and therefore compensated for attending. And transportation is just a part of that compensation. Parents are maybe not having that opportunity. So transportation could get in the way. And maybe parents have children that they are caring for at the time, and so child care is another thing that keeps them from being able to attend. And if they're not paid to attend, like those other of us who are there, and they have to leave the work that they're doing, there is a cost to being a part of that, and sometimes that's prohibitive. How do you get materials to people if you want them to be a part of this meeting, if maybe they don't have access to printing things, etc.? And maybe they don't feel like they're integral. So if that's a barrier, what can we do about those things? I work and support the state of Iowa as they get their mental health consultation up and going, and they're developing a statewide system. And they understood and truly worked to get parents' involvement in their leadership team. We tried a number of things, but we kept running into barriers as we've identified before. And we tried to include parents in various ways. One of them was maybe taking the information and sharing it with an already established parent group that was a recipient of consultation and having them give us feedback and then take that feedback to the team. But it didn't work. It wasn't what we were looking for. We were looking for someone to help us know how to do the work according to what they received. And then eventually, I think we were about a year or maybe a year and a half even into the work, and something beautiful happened. One of the members of the leadership team had worked with a family who was willing to join the leadership team, and the person who was a member did just what we talked about earlier. She connected with that person because she had a relationship with her. She offered her transportation because they would travel together. And it was about an hour or more away, so that they had time to talk about it. When we were at the meetings, there was encouragement for everyone to have a voice, and this parent just made it rich. She brought up things that we hadn't considered. She talked about ways that parent would hear information better than what we were thinking of doing. She gave us things to think about that maybe we would not have considered otherwise. And she's a beautiful, well-spoken, dedicated parent, and it really did help us make a difference in what we were doing. It was also the relationship that she had and the processing before and afterwards that kept her coming, that keeps her coming, and has helped us have a richer discussion each time that she's there. So having that mentor and that support really addressed the barriers to participation. I've also had the privilege of supporting the state of Wisconsin, and I'm in awe of the work that they do. So I'm excited to now turn this over to Kim Ethan to talk us through some of the things that they've done in Wisconsin as they address having parents in their work. So Kim, let me turn this to you.
Thank you, Linda. For Wisconsin, we decided to embed our mental health consultation program in our Children's Mental Health Collective Impact effort. And we did that for two very important reasons to us. One, that Collective Impact had a multi-system approach. So all of the players that we did, because we wanted consultation to be universal in our state, all of those players were at the table. Our birth to 3 early intervention, our home visiting, our child welfare, our medical personnel, and our early care and education. In addition to that, which was also very important for us, was that the collective impact effort had only one rule, and that was that parents and young adults had to be a part of every level of the approach that we took. So from our executive council down to every work group, they not only had to participate on the work group, but they had to co-chair the work group so that they were a part of the leadership that made the direction for our project in Wisconsin. And for those of you who might not have heard about collective impact, I'll just take a minute to go through what it is. Collective impact really said that too many organizations were working in silos. They were working in isolation. They thought it would be better to bring together the people in a structured way to achieve social change. So you would do it with a problem that was complicated, it was complex, and you would want to have different viewpoints from lots of different people. So in collective impact, they say that you have to have a common definition of what the problem is and a creative answer or solution that you figure out together, that you measure your progress so that you know you're going in the right direction. You have some shared measures that you all agree upon, and that you have what they call mutually reinforcing activities. We don't all do the same thing, but we have the efforts that we do move towards the greater whole. So for us, that's healthy social-emotional development for children in Wisconsin, and that we have constant communication so that we all know of things that are happening in the world of children's mental health and mental health consultation, and that we keep each other informed so when there are things that we could build on, we're well aware of what that is. And in our state, there's always a backbone. In collective impact, there's a backbone organization. And in our state, that is the Office of Children's Mental Health. They are a small office of 5 people, one of which includes a person that supports the parents, who are the voice of the lived experience, one who collects data, and one who is a communications expert who then gets out that constant communication. We're very lucky to have that support in Wisconsin for our parent effort. And parent voice fits really well into the principles of practice in collective impact because it really pushes us to have equity. So when we are sitting at a table in a work group or in our executive council, when we have name tags on the table, it doesn't have our position on it because we want to have a level playing field. We want everyone in the room to feel like their voice counts with the same amount of weight, and that we should have community members and multiple stakeholders because we want to have different perspectives. We know that when there is a challenge that's out there, that there are many viewpoints or many different paths that we could take down to get to a solution. And we want to have all of those voices at the table with those ideas there because that's going to give us our creative solutions. And that we always use data to check ourselves to make sure that we're going down the right path. And if it's telling us something other than what we expect, it gives us a chance to sit back and think about, are we measuring the wrong thing or are we just not giving it enough time? But we don't spend a whole lot of time if we're not getting the results we want. We think about what we can do to change that approach. And it also helps us cultivate leaders, not only for the professionals who are sitting around the table, but also for our parent leaders. Because we ask them not only to look at the individual programs, but to look at the system as a whole and really help us change the way we're delivering our services for our families. It also builds a culture of relationships because when we're sitting around the table, every executive council meeting has a half an hour that's set aside for relationship building. So that if you've heard someone talk about something in the meeting, you can go up to them and ask them individually or give them ideas that you have. But we know that that respect and that relationship building is what's going to help change our system. And that we always take it back to our local context. All of our parent partners that sit at our state level also sit on committees at their local level so that they can integrate what they've learned at the state level into the county or the tribe that they're working in at home. And in Wisconsin, as in many places who have consumer voice, we like to say nothing about us without us. That parents are at the table for every decision because we believe that we will not have system improvement if we don't have the people who are actually experiencing the programs and the systems at the table helping us make those reforms. And we really believe that it helps our child-serving systems to be more effective, more efficient, and more engaging. So how a person becomes a parent partner for us is an actual application. So it's almost like having a job application. There's a paper application that they fill out about their experience that they've had with consultation and what they think that they might bring to the system that would be helpful for not only their family but for changing the system. After the application is submitted, they also have an interview with one of those people from the backbone organization that supports the parent voice. And at the end of that interview, the two of them decide whether or not it is a fit for the parent. And if they decide that it is a fit for the parent attends 3 meetings before they make the final commitment so that they can really get a flavor for what's happening in the system development of the consultation. When they make that decision, we also assign a mentor to them so that there's someone sitting beside them in any of those meetings that they could write a note to in the meeting if they were not understanding something, or that they can talk to before and after the meeting, as Linda was saying, to sort of prepare them for what's going to happen. And one of the things that we have in our meetings is what we call an acronoc, because any of you who have been in a meeting where they speak bureaucracies, you might hear an acronym and not understand it. In our meetings, if someone says something who's speaking at the moment and they hear a knock on the table like that, that's what we call our acronoc. That means that you've been speaking in something that we don't understand, and could you please go back and tell us what the meaning of those initials are. We also have a great deal of training that we use to support our parent partners. Every month, they have an opportunity for a training that they have desired. So we might do training about how our legislature works, how a bill becomes a law, how the budget process works, where they might have a voice in intervening with their legislators or the Joint Finance Committee for the budget, where they can have an ask and have some influence on what the legislators might introduce. Or they might get some training on trauma-informed care, because what does that mean when we think about a family situation with a trauma lens? Or some training on resilience and how to promote resiliency within families and themselves. Or some training on leadership. So they decide what those trainings are and what they need, and then we work to be able to provide those for them on a monthly basis. We also have them serve as co-chairs for each of the meetings, as I said before. And in our executive council, there's about 40 people who are the members of that council, and we have a quarter of the people who are parents or young adults, because we really feel like it needs to be a strong voice at the table. So that is what we dedicate our resources towards, is having those 15 people at the table. And one of the things that we're also very fortunate to have is that our parent partners co-train with us. And we have had a parent partner who has been with us from the beginning of our effort. When her now 10-year-old son was very young, she received consultation services in a program that she was involved in, and it made a big difference for her. And she has been a big advocate and co-trainer and parent partner at the Collective Impact effort for us. And it was fortunate enough for her to make a video for us so that she could share her experience on what consultation meant to her and her family. So we're going to go ahead and show that video.
My name is Sharice Daniels, and I'm a mother of 5. I was first introduced to infant mental health consultation when my child started Head Start. He was then 4, going to Head Start's 4K program. And I remember, because I had just moved to Wisconsin from Florida, and I had no formal supports, no family here, and we were really struggling, not only with the move, but also with a lot of different circumstances that we were facing that were very hard, and honestly hard for a lot of families within the program. And as my son was attending Head Start, we started to notice some behaviors that were very concerning. And I remember trying to figure out, what I could do as a parent, and teachers were kind of racking their brains trying to figure out what they could do to help Rowan as well. And it wasn't until that we were introduced to an awesome infant mental health consultant who came into the classroom to observe Rowan's behavior. And at that point, everything changed for us. The teachers felt supported in what they were doing, and I felt supported as a parent, because with infant mental health consultation, the whole goal is to make sure that all the adults in a child's life are being supported. So not only were the teachers receiving the supports that they needed, but through that, I was able to get some different tools under my belt that could help me be a better mother for my child. And in return, Rowan was doing so much better. By the end of the year, we had seen so many leaps and gains in his education. I was so proud of him and so excited to be a part of a team, a working team, a well-oiled machine. And ever since then, I've been an extreme advocate of infant mental health consultation, because not all schools and not all systems have this amazing resource. A lot of parents struggle to find resources that are holistic, that help not only teachers and professionals, but also parents in making the best decisions for their kiddos and trying to find ways to cope with some really real situations. And so I'm really grateful to have received that, and hoping that all kids are able to receive services like this, not just kiddos who are considered at risk, but kids in general need extra support. Parents need extra support, and professionals, and me as a mother and a professional, I truly believe that we all need that support. And so infant mental health consultation has been a lifesaver for us in that way. And Rowan is doing amazing. Rowan is now 10 years old and in the 4th grade and making some amazing strides. And although this wasn't a one and done, it's been a journey for us, but that was a really awesome starting ground and foundation for our family, and I'm grateful.
As you can see, we were very fortunate to have someone who's very eloquent at being able to explain what consultation meant for her and her family. When we were starting our program, we needed to reach out to families that we had been involved with to ask them to make the application originally. We started out with about 6 to 8 parents who were in the original group that we reached out to, and they support each other. Besides being a mentor in the original group, of course we didn't have mentors, we just had the person who was in the Office of Children's Mental Health, who was a parent who had experienced consultation. And so they formed the core of the parents that are now there. And we just kept reaching out to parents, mostly by word of mouth. Some of our parents to different conferences or community nights where parents might be gathered and spread the word, because they were very excited about having that opportunity to be a part of the system's change. There were many barriers that we worked through and some that still arise. Transportation was a barrier and childcare. So we were able to offer stipends for meetings, and if you're a co-chair for a meeting, you get a larger stipend because there is prep work before each meeting. There's always at least one phone call, if not more, between the co-chairs and the support people who are there to take notes and help run the meeting. There's always compensation for transportation, so you also can get mileage and parking reimbursement. But we also have Zoom or Skype or some virtual way of entering a meeting for each meeting available for those who can't get there on time or because of the distance. As I said, they not only mentor each other, but they're a support group. They chat on Snapchat in between meetings. They talk about trainings that they've been to or topics that are important or community events that are going on. And one of the things that we weren't prepared for, but it ended up happening for one of our parents, is that giving them the stipend actually made their child ineligible for a program that they were involved in that was income dependent. So now when we talk with people about whether or not it might be a good fit for them, we talk about that so that they can check that out before they actually decide to take the stipend for the meeting. And if not, we think of other ways that we can help support them, or that they can be a part of the system's change. We also have our parents not only be a part of the collective impact effort, but if some of the state departments have things that they need to do, like if they're changing a policy or if they're thinking of introducing some legislation or changing the administrative rule, they might use 1 or 2 of our parents to sit on their committees so that they can have input, or they might ask them to review some of the language and documents that they're changing at home. So for some of the parents who couldn't be a part of the meetings, they can still be a part of the process, and we find other ways for them to do it. None of those barriers have been things that we couldn't overcome. For now, I'll turn it over to Dawn, who can speak about the role culture has in engaging families.
Thank you for that, Kim. I'm just so excited hearing all of this information. Linda and you, Kim, both shared some great feedback. Thank you so much for all of those pieces. And thinking about all of those things, we also have to remember the importance of culture. Thinking about culture when we engage families, but we're referring to the following things. It's a way of life. Each group has their own culture. Sometimes we have a community that has a different culture from another community a few miles away. There are things, language, ways of doing things, traditions that are passed on to the next generation, and they include patterns of human behavior. We probably all know of some communities that are, oh, they're a basketball culture or they're a soccer culture. We know of these little places in our states and our counties where we have different cultures even though we're all in the same country. And language is a big part of that as well, where language can be a barrier and we have different languages within our communities. When we're thinking about engaging families from those different cultures, when they come onto our leadership teams and when they support these consultation systems in improving and meeting their needs. And also with cultural considerations, we are talking about things to consider when different cultures of people come together and interact and communicate. So when a consultant is interacting with a family at that most basic level there are most likely two different cultures interacting. So culture of the consultant and where they come from is coming together with the family's culture and thinking about how do we build this relationship with these two cultures that two people bring together. And then also thinking about the consultant carefully consider their own culture and beliefs. Sometimes we have biases, we have different ways of speaking and doing things. So thinking about how might consultants' way of being affect how they understand their families from different cultures. One of the things that Linda referred to earlier about the infant-toddler mental health tenets, if you have time, you can refer to the diversity-informed tenets of infant-toddler mental health. And they have a good list and ideas of ways that we can honor other types of knowledge, honor other cultures, and really make sure that we understand those pieces. I also have a little story to share. In my other role, I also work as a consultant on the Navajo Nation, and there was a situation that it's very rare where I needed to support a home visitor. And this home visitor was very concerned about this mom who was having a hard time with her two little ones who were both under 3, and we all know how stressful that can be if we've ever cared for two little ones. But one of the things that had come out in that conversation with the home visitor and the mom, and I was there in support of all of this process, there was a possibility of mom having postpartum depression and also feeling like I don't know how I feel about my youngest child. Really tough, heavy feelings there. And she also shared that it's hard to share this because in our Navajo culture, we don't ever want to think in a dismissive way about children. And we don't ever want to voice it because it's something that we hold very sacred. So she felt like it was even harder for her to share. So the home visitor and myself, and we just supported her in her sharing that and shared with her how much strength she had to come forward and share that with the home visitor. And we continue to support a referral for the mom to continue to get services. But that's an example of things that we need to keep in mind if the consultee, the parents, the families are coming from a different culture, how it might be more difficult to share some of these things around mental health, around heavy feelings they may have in being a parent and caring for others. But I also wanted to speak to engaging families that represent tribal communities through their knowledge of culture, language, and customs. So maybe you have a county or a state system or program and you want to reach out to tribes in your area or near your area, and you want to engage them as well. Another piece to think about is engaging families to describe how consultation systems will look in their culture. Maybe there's a lot of similarities, for example, the strengths-based piece. So reflecting back on my work on Navajo Reservation, there is a big focus in the culture of focusing on the positive, on the strengths, honoring those strengths that families and children come with, and that's in alignment with consultation with infant toddler mental health concepts of focusing on the strengths and coming at solutions through strength. And then also looking at engaging families by seeking their feedback as a service recipient, asking them, does this consultation service honor your culture? Asking them to share with us how we can honor your culture. One of the examples I have really quickly on that has to do with a little one that I supported one time in the other work that I do, and the parent, a single parent, wasn't able to be at this meeting. She had a situation that didn't allow her to be at this meeting, but we connected her through phone, and there were some health things there with this parent. But when we got together to meet with the mother, the other parent caregivers, adult caregivers of this little child, I said, well, are there any other resources or things that you feel like could help this little one? And they had mentioned they knew a medicine man or woman, a traditional practitioner in their culture. And they said, well, we've never had a prayer done for the children. We've had prayers done for us as adults, as families. So they went and had that as a part of the plan. And, I honored that, and we put that down in the plan to support the child. Long story short, the child really responded to a part of that support with their behavior in the classroom. So those are just some examples of ways to honor and incorporate those important pieces around culture. So moving on, we have some tools that we can share with you from the Center of Excellence website. We call it our toolbox. So if you take a look at this slide here, we have this video. It's called Systems Collaboration. It's 7 minutes, but at 5 minutes, 22 seconds. And if you go watch this video, it talks about how to engage families as partners. It's really nuanced. It's really kind of hard to have it sink in unless you listen to it 2 or 3 times, or maybe if you're in the exact same process of collaborating with partners. And a couple of things that it talks about are make sure you involve families as consumer of services, what we talked about earlier. So having families as key players in evaluating services, and also recognizing what we just saw with Kim's video that she shared, that families are built-in advocates. They keep us the best we can be in providing the services to families. So looking at the next slide here, we have the Center of Excellence Toolbox. Here are a few more items that we can peruse through. So the first one there, it says family engagement, consultation stakeholder as a service recipient. So this is a podcast webinar section of our toolbox. And the next one there, we have how consultation can help families affected by maternal depression. This is also a webinar, and there's also tip sheets that you can go through, and these are, all pre-recorded, so these are really helpful in thinking about these things, how consultation can help maternal depression. And then the next one here, we have how consultation can help families affected by opioids and substance misuse. So thinking about these pieces, this is a webinar and also tip sheets, considering culture and all of this. It's a lot of information, but we hope this has been helpful for you. We have a coming soon Head Start resources that we will share with you, but I'll have Linda speak a little more on this one. Linda?
Okay, great. We have on the Head Start website, you'll see this tool that is for professional development, and it is for mental health consultants. And all the bubbles, if you click on them, take you to a specific thing about that title. And you'll see videos, you'll see resources, you'll see all kinds of information. And coming soon will be one on family engagement. So keep an eye on that. We hope that we provided for you some information on how important it is for families to be engaged in the consultation process, and that you heard from some families and some work that was done in Wisconsin that talked about what actually has worked and how they've addressed issues and how important they are to the success of the whole system.